We've got to, just making cuts without a plan is dangerous to Oklahomans.
Some Oklahoma community leaders sounding the alarm over how President Trump's One Big Beautiful Bill could impact all of us. Thanks for joining us. I'm Amanda Taylor.
And I'm Carl Torp. That budget bill is now one step closer to reality after the U.S. Senate narrowly votes to move it forward to the House.
The 1,000-page bill can feel daunting to understand. So tonight we are going in focus on how the bill, if passed, could change your life.
We'll show you the bill's latest progress, plus break down the biggest concerns from lawmakers. That includes SNAP cuts and what that could look like in the long run. We'll also look at the potential impact to health care and other elements like how it could help secure the border.
And now let's take a live look at the House Rules Committee in D.C. as they debate the Senate's version of the bill. If they pass it tonight, the full House is expected to meet tomorrow for a vote. The president has asked his party to get it passed by the 4th of July, but said today he'll be willing to give on that. Now let's get to it. The Senate bill would slash funding for federal food assistance over 10 years.
It would also make it harder for people to qualify for it, which impacts more than 700,000 Oklahomans who rely on the program. News 9's Jordan Fremstad takes us behind the numbers on the potential impact to our state.
Well, guys, many lawmakers on both sides of the aisle have concerns about the long-term impacts of this bill, and people who work with vulnerable populations in Oklahoma argue this will hurt people trying their best to survive.
The bill as amended is passed.
The cost-benefit analysis can't just be done on a balance sheet.
Following the Senate's passing of President Trump's Big Beautiful Bill,
We know it's not going to be good
leaders in Oklahoma remain concerned.
because we just know so many people personally who rely on those programs.
Now only the House stands in the way of President Trump's pen to cut SNAP funding by $287 billion over 10 years. News 9 political analyst Scott Mitchell expects the bill will pass by Trump's July 4th deadline.
And they'll hold it to the last minute, and the president will step in to make sure he gets his photo up on the 4th, and it'll be done.
According to the Oklahoma Policy Institute, 1 in 6 Oklahoma households rely on the Supplemental Nutrition Assistance Program, or SNAP. Most of these homes have children.
If you take these supports out, you kick somebody's legs out from under them, then what?
Rachel Conley leads Stillwater's Our Daily Bread Food and Resource Center.
It just puts everybody in a really hard spot.
She said there's a reason many Oklahomans need these resources.
The cost of living is high, and the money that people can make when they work is not.
Homeless Alliance CEO Megan Mueller works with people in these programs every day.
I completely reject the notion that people who, are experiencing poverty or experiencing homelessness are lazy and that they can just make the choice to change their circumstance overnight. It's just not that simple.
Rachel sees the pain in people's eyes
It's hard to ask for help.
when they walk through these doors.
The majority of our guests who are on SNAP are embarrassed about it. We have so many elderly couples that'll come in and say, I would work, but no one will hire me. I'm 80.
She says people are making choices about her community 1,300 miles away.
No one sitting in those rooms making those decisions has called me to ask how my guests feel about it.
Choices that change the lives of people behind the numbers of a budget.
Kicking one support out of the way and just seeing who can make it is not anything of the America I want to be a part of.
Now, under these proposed provisions in this bill, states would have to share a portion of the costs of SNAP. Hunger Free Oklahoma estimates that would cost the state up to $270 million in new annual costs. Carl?
Jordan, thank you. The bill would also increase the age of work requirements for SNAP benefits from 54 to 64, potentially affecting more than 100,000 Oklahomans. Now, we know the other major concern over the bill is proposed cuts to Medicaid, and state data shows about 1 in 4 Oklahomans rely on it for health care.
So we spoke to Senator James Lankford about the concerns over the proposed drop.
So a large part of what we're talking about is how do we get work requirements into Medicaid? No conflict on that one. How do we make sure we start pushing the burden back towards the state some and trying to balance that out to where the federal government's not carrying more than it was planned to be able to carry? And with that, how do we make sure we protect rural hospitals, that we don't leave rural hospitals vulnerable? Those three big things are all now accomplished in this bill.
Meanwhile, the Oklahoma Hospital Association says the cuts won't just affect Medicare recipients, but health care for all Oklahomans.
The group expects hospitals statewide to lose over $8 billion in federal reimbursements over the next decade. Hospital leaders also say that they would need to get rid of nearly 15,000 jobs across the state to offset that loss. The cuts could also force more Oklahoma hospitals to close, and so far 10 have closed since 2005.
What that means is they may not get to have a doctor close by to them. They may not be able to have an emergency room close by. And in healthcare, we know minutes matters.
The Hospital Association is also concerned because Medicaid covers about half of the births that happen here in Oklahoma. That's according to 2023 data from KFF, the country's leading health policy group. Hospital leaders say Medicaid cuts this drastic means we could see fewer hospitals that can deliver babies.
That means longer drive times for pregnant women who need access to care. That means increased logistics, stress, and pressure for their loved ones.